Hello, and welcome to How Are You Rare Disease and Disorder Forum. We're so excited to welcome Sarah Farrell to How Are You today to talk about a rare disorder called FND. We're going to learn a little bit about that disorder as well as an exciting book that Sarah is authored and featuring in Amazon Prime. We'll let you know a little bit more about that during today's interview, as well as in our course description. Now, let's welcome Sarah Farrell. Welcome, Sarah. We're so excited. I'm Marilyn Crawford, founder and CEO of Howa Health and co-creator of the Howa U e-learning platform. Sarah, tell us a little bit about yourself.
Yes, thank you for inviting me to your meeting, Marilyn. As you said, I'm Sarah Farrell and I live in the county of Cornwall in England. And I'm actually a sufferer myself of FND. And I've come across a lot of other people that have got FND. And I've written the book because I want to generate awareness of it and hopefully help more people get more support with what they actually need.
That is a very commendable thing to do, and there's so many people that are suffering from different rare diseases and disorders, and without that awareness, they continue to suffer and they're not getting the appropriate treatment that they need, or even some of our specialists and our physicians aren't finding the resources that they need for the diagnosis. So I really appreciate what you're doing, and I really look up to those that are bringing such awareness. So we're fortunate to have you here today. Sarah, many people have never heard of FND, but might be walking around with symptoms of that rare disorder. Please share with us what does FND, what does that stand for? And just provide more of a general description of the disease or disorder.
Well, FND stands for Functional Neurological Disorder. And if you apply it to an analogy like a computer, the hardware itself is working totally fine. But there's a problem with the software. So if you relate that back to the human body, physically there's nothing wrong with the body. But the actual functioning which goes through from the brain and the neurological system, there is a problem there. And it can manifest itself in so many ways. You can have people that have seizure-like symptoms, that you can have people that are blind through it, have moodiness, you can have chronic bowel and bladder problems. I myself have functional movement disorder, which means every time I've got a relapse, I can hardly move. You can get paralysis. It manifests its way in so many ways. So whatever way the body functions, that's how it can come out.
Oh, very interesting. Well, you've shared some of the signs and symptoms of the disorder. Are those pretty much the top classifications of the signs and symptoms, or are there any others that we should be aware
of? The thing is, everybody has functional awareness, if you think about it in this way. If I was to make you embarrassed and feel embarrassed, that's a mental state. It's highly likely, and most people do, they blush. And that's a physical reaction to a mental state. So in short bursts, that's where it works fine. But when it becomes chronic and disabling, that's when it's a problem.
Interesting. I love your analogies. That really helps our learners to understand things better. So thank you so much for just putting that in terminology that we can all understand and relate to. That's very important for us. You know, when I started learning about FND myself, because I was just so curious after I received some information from you, and I so appreciate you just reaching out to create a broader awareness, but I said to myself, wow, I actually have some of these signs and symptoms that I'm reading about. So how does one go about, you know, determining, is it FND or is it something else? And did you have that struggle yourself earlier on before you came to find out more about this disorder?
Yeah, if I can I'm not a medical professional, so I can only speak as a layperson. But if I talk from personal experience, then I can relate it to how I find other people having the same problem. I started off basically, I had my head basically felt like it was going to blow apart in a staff meeting. And the next day I couldn't walk properly, and I couldn't understand what was going on. So I went to see the GP, and the GP decided to double my depression tablets. So I thought, well, okay, I don't understand how it relates to more walking, but you trust the doctor. Then it didn't get anywhere. So then I went back again, and every time I kept on a relapse, I kept on getting a lump, a very hot spot in the back of my back, the bottom of my back. Oh. So they said, oh, you've got a lymphoma, a fatty mass. I thought, well, that's very odd. They said, don't worry about it, it'll go away. So then it didn't go away, and I'm still struggling. I can hardly walk. When I'm sleeping, I come around, my body is shaking, it's in spasms. This doesn't make sense to me at all. Well, in the end, they thought, right, she might have a cyst on her spine, and maybe it's affecting the nerves. So I went to the general hospital and had an x-ray, and it was found that there's nothing wrong. Nothing wrong at all with the spine, nothing whatsoever. So then the next time I seen the GP for my follow-up, but I think you might be making it up. But they didn't say those words, but that was basically what was implied. And I thought, no way, this is not happening to me. I know my body. I'm not making it up. And a lot of FND sufferers do get this sort of stigmatization. Well, then I was very, very fortunate, because the next time I went back to the GP again, it was a senior doctor, retired, and he was working as what we call a locum. Okay. And as soon as he's seeing me, he says, you need to see a neurologist.
Oh, thankfully.
Yeah, I wanted to see a neurologist, and there are actually tests they can actually do to prove whether you've got FND or not. And as soon as I was in there, within a short time, I had the diagnosis, and I was able to go from there.
Well, thankfully that specific doctor was there and had an awareness of it and knew the diagnostic testing and tools to use to discover that. So I'm glad that happened. What a journey. And FND is just one disorder amongst so many that patients do struggle with trying to find the right diagnosis or the right physician to lead them towards that diagnosis. And some of the rare diseases and disorders, once there is a broader knowledge of them and our physician community is more aware of the specific course of diagnosis and towards treatment, we do tend to see some of those rare diseases and disorders leave the list. They're no longer rare. It's just that no one was able to really truly be diagnosed in the masses. So who do you know yourself, who is the greatest risk for getting this type of a disorder? Is there anybody that's in a risk category? We talk about risk categories quite a bit.
Yeah, absolutely. Before I get having diagnosis FND, I'd never heard of it in my life before. It used to be called conversion disorder at one time.
Oh, okay.
And prior to that, it was called hysteria in Middle Ages. So it's been around a very long time.
Oh, my.
Anyway, I was researched it, and basically the group people that fall into the 3 risk factors are, first of all, people who've got long-term stress. I was a teacher for 20 years, and a teacher can tell you it's quite a stressful lifetime, times.
I think our teachers here in America would quite agree with you right now, as well as teachers around the world.
But also very often there's early life trauma of some description as well. So that falls into one camp. Another camp is that people have had a car accident, not necessarily a car accident, but some kind of physical injury. So where they've got injury to the body, and where the brain should go back to normal, it somehow gets affected in some way. That's another group. And the third group is people who have long-term illness. So those are your three main groups of people which are at greater risk of developing FND than, you know, other people.
Well, and again, I think many people would fall into one or more of those categories. Stress has just become such a dominant presence in most of our lives, and some of us do not know how to respond to stress from a self-care perspective.
Absolutely.
Many of us are in car accidents, and you know, I think when we look at those three broader categories, that brings some aha moments to probably many of those that are going to be listening to this interview. Well, Sarah, please share your goal to raise awareness for FND globally through this great new book of yours, Demelza and Corentyn.
Yeah, if I can take the chance just to show my book. I published it on Amazon, and it's about a fictional couple. The lady, Demelza, she's got FND, but she's met Corentyn. They're in the early stages of their romance, and it's what time should she disclose her FND to Corentyn. Also, it talks about the fact that she's lost her career through it, which I did. I lost my teaching career through it. Also, it talks about the effects on her family, just very simple things like the parents want to go away on holiday. Well, Demelza cannot be left on her own because, you know, somebody needs to care for her in case she needs a wheelchair. So it's all these, you know, daily living considerations that come to it as well. So FND is threaded throughout the book, but I'm hoping people enjoy the storyline at the same time, which is the reason why I took the approach I did.
I love that approach. And you know what else I love is the fact that whether it's this disorder or a different disease or disorder, many people are going to have that same journey when they're first meeting someone and they need to share that intimate information about their health. So the fact that you've been able to capture that throughout your story is just all the better. I think it helps us to have a greater awareness for the disorder that you and so many have been struggling with, but also on how to approach that in relationships, whether they're romantic relationships or even relationships with other family members or friends. So I think that's very important, and it was a wise decision for you as an author. So thank you for that.
Thank you.
Sarah's book is being sold on Amazon, as we mentioned, so all our learners can contribute to learn about FND after this class. The Amazon link and the links to other resources are listed with the video course for you to continue that support and share with others. It's important to Sarah, and it's important to How Are You that we all have a broader knowledge of different rare diseases and disorders. Now, Sarah, if you think you or someone you know may have FND, which obviously you know you do, where do you start with the testing, and what physicians specifically are treating patients that are presenting with these FND symptoms? You had mentioned a neurologist, so is that the starting point?
Yeah, once you're in this country, GPs are, I'm in the United Kingdom, GPs are not allowed to diagnose FND. The only practitioners that can are neurologists. And the problem we've got in this country is getting the GP to recognise that you've got FND, because some do, some don't, and it is a barrier in our country. I don't know what it's like in the States, but that's the problem over here. But once you get to the neurologist will then send you to a rehabilitation centre. There's one in Bristol in the UK, which offers 3-week inpatient treatment basically. And there's no cure for FND. But when people learn how to manage their FND, about 20% of people actually get to the point where they're symptomless, which is great news.
That's fantastic news.
Yes, it is. Whereas other people have got the knowledge now how to manage it, and because the brain is no longer panicking about it, it's a journey then they can follow through with more confidence.
Well, I think the confidence and just the knowledge and the education and time to learn more about the actual practices that you as a patient would need to do. Is there stress reduction techniques that come into play?
Absolutely, yeah. The big push, like you said, is knowledge, which you gain from the Rehabilitation Centre, but also CBT, cognitive behavioural therapy, is a big one, and also mindfulness, meditation, anything that's holistic like that, which helps to calm the brain down. Most teachers will relate to me on this. When you're in the classroom, you've got to do this, that, and the other, and your brain is constantly on the go. And it takes a lot to break a habit of 20 years to learn to calm right down. And for me personally, it was a big help to learn how to manage that.
I don't know, I'll have to look into it if there's something in the States or other countries that's similar to that. That sounds like a wonderful program to just have 3 weeks to learn those skills and, to try different medicational management techniques. I'm sure that comes into play as well. And just have that rest time to process now what you've learned you have, and to try out those techniques that you're learning. It sounds like a very wonderful opportunity. I'm not sure that I've ever heard of that here in the States, but I'm hopeful that that's something that we have in many of our countries, because it sounds like it would be very successful. Once you leave that, go ahead.
Yeah, if I could just add to that, we only have 6 of these rehabilitation centres in the throughout the whole of the UK.
Oh, wow.
But we're very, very fortunate to have 2 of the world's leaders in FND in this country. One of them is Professor John Stone up in Edinburgh Hospital, and the other one is Professor Mark Edwards. And I know they work with Harvard University, and also I get confused, but it's Baltimore and Massachusetts General Hospital.
Oh, okay.
And they've been doing a lot of research together. So I wouldn't be surprised if there isn't any rehabilitation centres in the States now, that it will be something that will come over there.
Well, we'll definitely take a look at that, and if what we find, we'll go ahead and put into the course materials so that everybody's aware of some of the additional research that we'll continue to do together. What is your best advice if you have someone that thinks that they may have FND? What would you say to them?
Don't ignore it.
Good, that's good.
The thing is that they find that people who get FND, the earlier you start treatment, the better their chances are that they'll be able to reduce the symptoms of FND, if not become symptomless. But the longer it goes on, the more chronic it becomes, and then, like other people, it can end up in a chronic problem for many years, if not the rest of their life. So in the UK, I work with a charity, FND Friends, which 20% of my profit of my books is going towards the support, because we're trying to ensure that people, when they first get FND, they get that treatment early, and then hopefully be less people suffering. So,
oh, that's excellent advice. What do you think is the hardest part of having it? What's the hardest part of having it for you?
Accepting it. Because, I mean, when you've got something physically wrong with you, you immediately think it has to be a physical problem. It takes a long time, it did for me, to accept that it was my brain that had the problem, my neurological system had the problem, and it wasn't actually physically wrong in my body, if that makes sense. And once you get to level acceptance and realizing what is happening, that's all part of the process of accepting and being able to manage it. So,
Wonderful information to share with everybody. This has been such a treat to have you on this interview today and just to learn more about this. But again, I keep thinking of these associations of other diseases and disorders and how one might think of that. I think anytime that we have something that's wrong with our brain, whether it's migraines or whether it's something much more serious, we tend to feel awkward that we have something neurologically impaired or out of sync. But we shouldn't. It's just like if your arm was injured or if your heart was damaged or any other organ in your body. There's no difference in that. Only we just it's incomprehensible sometimes to think about our brain having difficulties.
Yes.
But it happens all the time, every day. And so I think the key is don't ignore it. I think that was your best advice ever. Get help. Don't let somebody talk you out of the fact that there is something going on and you know your body. I think I heard you say that. I knew my body. My body wasn't making this up. So you continue to seek out that diagnosis that you ended up with. Very good. Well, I want to just thank you, and not only for being with us today, but for writing such a tremendous book. And it was, pretty relevant for today. I was able to read part of it before the interview, and I'm looking forward to reading the full view. Amazon has a little bit of a delay because of the shipment between your country and our country, but I was able to read those great pages in the beginning. And I didn't the couple meet online? It was an online.
Yes.
And I know they're fictional couple. I think it's a fictional couple, but did you have a similar experience yourself where you had to introduce the disorder to somebody that was a new relationship for you, whether that was a friend or something more than a friend?
No, I've not had a personal experience like that. I'm single, very happily single. But when I was in my career and I had this diagnosis, I had to sit down with my head teacher. And my head teacher had never heard of it either. And so I had to explain as best way I possibly could why I needed the time and ways, to heal. And that's where my difficulties came in with that. I had a good relationship with my head teacher, but to explain something which is not in their normal, remit is not so easy. So, yeah.
Oh, well, thank you so much for sharing your journey and for bringing this book to our attention. It is is a Kindle version as well as a soft copy?
Yes, a paperback.
Paperback, yes. Excellent. So either version would be great, and we'll go ahead and put that link into the course description. Sarah has shared some wonderful resources, and we've gathered a few resources of our own so that everybody can learn a little bit more about this quite fascinating disorder that until Sarah brought it to my attention, I didn't know about it. And now I'm more curious about it than ever, just based off of the three main ways that you might be higher at risk. And that's something that so many of us have had incidences of, as well as some of the symptoms that present themselves. So definitely worth looking at and knowing about and bringing to all of our How Are You learners. Sarah, I hope we can continue to talk and learn more and continue to share in your journey. We will have a place for our learners to comment on today's interview, so we may be bringing some questions back to you,
absolutely,
back to our learners as they continue to want to grow in their knowledge of this disorder. But thank you so much for joining us today. It was a pleasure to speak with you.
And thank you. It's been enjoyable talking to you too, Marilyn.
Excellent. Well, thank you to all of our learners that are interested in our Rare Disease and Disorder course. We'll be talking to you more about our next rare disease and disorder, which is PANDAS. It's a pediatric condition, And we'll learn a little bit more about that next month. Thank you.